I'm going to demonstrate how a staff member, nurse in a correctional facility or at a home health agency is sitting with a patient and needs to reach out to one of your remote wound care specialists. So right now, what you're seeing on the screen is our virtual care platform. And I'm logged in via web browser, but that person can be logged in on their mobile phone, on their tablet. The experience is going to be the same. So let me walk through how to reach out to another staff member. So we break down the platform by patient contacts and caregivers, and then staff members. So we're going to focus on staff members. And I'm logged in as Dean Klein, the RN nurse right now. So I can view anyone within my member directory here. These are going to be other staff members that I have access to, and you can include their title in their name right on the display name, or we'll build out these specific groups however you need them by. They could be by location, or they could be by specialty. So going back to this example, I'm sitting with the patient. I need to reach a wound care specialist. So I'm going to click wound care. And now I have two options. I can either reach out to someone individually if I know that specific person that I want to reach, or we give you the option of call progression. And this is reaching someone who's ever first available. And this is who's ever logged into the application. I don't need to look up to see who's available or who's on call. When I select that button, it's going to route to the first available user. That's how it works. Let me go ahead. I'm going to reach out to Steve. We'll pretend Steve here is our remote wound care specialist. And I have two options. I can either securely message Steve, and I'll show you that right after the telehealth visit, or I have the video visit option. So all I need to do is click on that phone icon. And then Steve and I are connected over video. So here's me in the top left. Here's Steve on the screen. He could see me sitting with the patient. Let's just say Steve is, and as you see, Steve can flip his camera around. So maybe he's sitting with the patient and needs to do that. If Steve was in an area where he couldn't take a video call, but he still needed to see me sitting with the patient, he can toggle his camera off as well. Okay. And now if I come here to the ad, oh, sorry about that, Steve. So let's just connect one more time. I don't think we need to bring in a third person, right? That's okay. Did we need to?
Yeah, let's show how you can bring in a third party.
Okay. Okay. Perfect. All right. So if I wanted to add an additional party, a third, a fourth, a fifth, a sixth person, I just come here to the add button, and here's my other options. You know, for adding another person. Let me see if I can just log in as another user real quick here.
And earlier, when he showed you the groups for the different ways to select people to make the call, that's where you can separate the different correctional facilities you work with, the different home health agencies, and you can click on them, drill down, and see those different employees. And they'll see that too, you know, when they need to reach out and contact you. They could see, you know, the primary physicians just for the general questions. They'll have a group for wound care. We can build it out the way that works best. And depending on who the user is, you can adjust what groups they're allowed to see. So obviously, you know, Johnson Correctional Facility in one location doesn't need to communicate with a home health agency that you're also providing. So they wouldn't see that. You would see it when you log in because you would have all the permissions, but you can control what they're going to see.
Yeah. So imagine there's a different person up here for Dr. Jim Brown. They're seeing me sitting here with the patient in the correctional facility. And then it works exactly the same if I needed to bring on a fourth or a fifth or a sixth person. I don't have any other users logged in right now, so I'm not able to.
And because we're watching the Cincy video over the Zoom, it looks like there's a little delay, but real time when I was on my device and Mike was on the computer, the video is crystal clear and there's no delay with the audio or anything like that. But obviously we were just watching it over another video platform.
Good point. So think of a more non-urgent type of communication as our secure messaging, okay? And this is 256-bit encrypted. You can have PHI sensitive conversations on the platform. This is an instant message chat. feature. If I'm on a mobile phone, I'll get a pop-up notification that I have a new message. Same with the tablet and same with the laptop here. So if I'm working in the office and I'm on another browser tab, I'll get a pop-up message. But as you can see here with my conversation with Steve, this is a one-on-one conversation. We can, share pictures directly. He had sent me a picture. I can download it if I need to. Maybe I want to save it in an EHR, save it in a patient chart somewhere. You can also share PDF documents as well. You can also mark messages as high priority. You can differentiate between just a normal priority and a high priority as well. And we do not cut off the message threads depending upon the date. So, if I need to go back a year or 2 years, I could go back into the conversation and see everything that was shared with me directly. Administrators can also pull up conversations between other staff members, staff to patients. So you have full transparency into what your staff is discussing on here as well. And we send read receipts as well, so you could see everything's date and time stamped. You can see if someone read a message. And then we also have group chat. Okay, so I'm having a one-on-one conversation with Steve, my wound care nurse. Maybe I do need to bring in a director or someone else into the chat. If I go to add someone to chat, and right now here's the two people having the conversation, but maybe I want to add Dr. Jim Brown here, and I go to next, and I go to save, what's going to happen is it's going to ask me, do you want to include the chat history so Jim can read up on it, or maybe we just start a new thread? So that's a little bit of a differentiator for us. There's not too many vendors that do that part. It's either all or nothing when you add someone. And a lot of other secure messaging vendors, you have to read the whole history. You can't start a new thread, or you'll have to start it somewhere else. So we give you that option that if you want them to be able to read the history, they can. So Steve, what did I leave out? So I think we might have hit everything.
No, I think that's all of it. And again, if you have a team on call for those different locations, whether it be a home health agency or a correctional facility that you're partnering with, they could come in there. They could say, okay, you know what, I need to just talk to one of the on-call nurses because we have a general medicine question, and they'll call the first person. If that person declines because they're busy, then it'll skip to the next. So it has the automated call progression. But you could, this is just an ideal way to set it up for these different organizations that you're going to provide your services for. And it makes it very easy on them. And if they don't want to just go to a call, they can send a secure message. So you'll see it would pop up. So I sent Mike the message as someone at one of the locations. It's supposed to say general medicine question, but so there it is. Okay. And Mike or whoever the end user is there could say, perfect. Let me connect you with one of the regular physicians, or let me connect you with one of the wound care specialists, or maybe you're going to have someone kind of triage this and then send it out to the right person. So that's another option. If you had someone like that administrator on call, they could field the video calls or the messages from the correctional facility or the home health agency, find out what it is that they're looking for, and then either transfer the video call to that correct clinician or bring that clinician on the secure chat. So there's different ways to field the inbound calls and inquiries.
Yeah, and we see a lot of times we really wanted to reduce the clicks and speed up the productivity of the person working in the system. So instead of having to go back to the home screen, go back to staff, look up Steve, if I'm in a conversation with Steve and it turns urgent, I want to hop right on a video with him, I could do it right from the chat directly. So we really wanted to reduce the amount of clicks within the system to get to something.
And is there also a scheduling option? I see events at the bottom.
So there's not a traditional calendar scheduling sense like you probably saw on SnapMD with the calendar and the scheduling. We're more focused on on-demand visits, but you can place a patient in a program, and these programs are completely configurable. You can name them and schedule them however you like. They could be just text and email type of reminders, but you can also include scheduled virtual visits within there. So maybe on day 3 or day 5 of the program, there's a scheduled virtual visit, but it's not as traditional as in SnapMD where I'm scheduling Wednesday, 2:00 p.m. to be on a virtual visit.
Okay.
We didn't get too deep in the scheduling because the vast majority of our clients they were seeing patients in some capacity before they started using virtual care. So they had a scheduling platform, whether it was in their Outlook or their EHR or just a standalone scheduling platform. So they didn't really want to schedule twice or have to switch. So they would schedule it like they normally would, and it would just be designated as a virtual visit through Cincy. Then they'd come in here and use it. So there is some minor scheduling. You could send out messages, you can send out reminders that something's coming up, but we don't have that calendar screen like the other platform does.
Okay.
Yeah, no worries on that. I completely get, as you said, why that was, that was not high priority.
Right.
Tacking on. A question I have about, let's call it archiving all communications, reporting. Well, what sort of things do, all the activity that's happening, let's call it specific to the groups. So if we do create, let's call it, prison, jail number 1, or do we have all that stuff parsed so that they have archive of all that, or just how does that work?
Yeah, so we archive everything. I believe we're starting with a 7 or 10 year mark, but yeah, you'll have full access within the reporting in the report section here. Ton of reports on staff utilization or patient engagement, or if you want to drill down into a specific staff member's activity. But this one will give you this detailed contact report. You can choose a date range. You can run it in real time if you just want to see for that day, or if you want to see over a period of month. But it'll break it down by staff, patients, and caregivers. And if you wanted to drill down into a specific staff member or a group, so like Dean Klein RN here, I can pull up all the virtual visits Dean Klein has done, start time, end time, who was on the call. You can also see if that staff user canceled or rejected the call as well. So, you're worried about someone's utilization or someone's productivity. If they're avoiding calls coming in, you can fully see that in the reports as well.
So everything is reportable. Like if Mike scrolls down a little bit, you'll see the call that we just did for you on the demo. And then you could also see the exact communication in the secure messaging. So you could go back and see what, Dan, you and Katie could go back and see what everyone is saying over the secure messaging if you need to review it for any reason. But there's the call we just did earlier. There's the one where we brought in the third party, a timestamp, date.
And you can see how long each participant was on the call for too. So if someone dropped early, you can see that.
Mike, you want to show the secure messaging report real quick?
Yeah. So this one's really helpful. If I want to search by one of my nurses here, I probably should have chosen one easier, but here we go. So if I pull up Dean Klein, my nurse, this is their historical thread. So right now I'm an administrator, maybe I'm a director, and I want to just pull up a random staff member. If I come over here, I can actually view the message thread. I can view the conversation that they were having as well.
Yeah, and you can see this goes all the way back to 2019 when we were doing some demos. And then if he scrolls down, it'll be the conversations that we were just having, recently. So it's all there. You'll be able to get a more or less the paper trail. You can see that one was sent. It's urgent. So again, you can have this oversight, and you could designate other individuals to be able to log in and have this oversight.
Cool. All right. Well, that's what I needed. Katie, is there anything else you need?
Do we want to see, just since we're recording, the same scenario, but with a patient and a physician versus just physician to physician?
Yeah,
that'd be great.
Sure. Yep. Let me go ahead and pull that up. So two different options. We do have a patient facing app that if you do have patients that are going to download an app on the Apple platform or the Google Play, the Android platform, they do have that. Or you can do a virtual visit. You can have a secure conversation, send an assessment to a patient without them having to download an app. So you can just send them out a link by text message. They click on that link and they join the call right away. There's no username and passwords for them. On the mobile app, what Steve was showing, with the branding and everything there, all they need to do is put in their date of birth when they get an invite. So no need for username and passwords. But if I'm a nurse and I'm viewing a patient profile, I have three options for communication on top. I have my telehealth visit right here. So if I wanted to bring in this person on video, so let's just say this patient, they were already logged into the application. Really only main difference here on the video visit with the patient is I have one more option, is caregiver. So this is the ability to add family members, add outside parties to the call, anyone outside of your organization.
And do they need to be a user?
You can hit just by adding them. So let me show you how that works. So if I come here to caregivers, so here's the two people right here. If I go to add, all I need is a name, and then I need an email, a mobile phone number, or just a mobile phone number. What happens is they get an invite, they can download the app if they want to, and they put in their mobile phone number once they download the app, or you could simply just send them out that link and they join by video as well. So either or. So it's pretty quick and easy to get those folks added. Same secure message here. So it's the same exact layout that you saw staff to staff. We have that secure messaging as well, staff to patient. Same exact functionality through the app, or just send them out a link and they go into a secure browser window. So it works exactly the same. And then the last one is this envelope right here, just straight up SMS, text message, and email. Okay, so if I click on that, I can free type a message. If I text or email my patient, so let's just say I'm that nurse and I want to text or email James here, it's never going to share my personal cell phone number. Let's just say I'm logged into the Cincy app on my phone. It all goes out of the Cincy platform. So no personal phone numbers or emails are ever shared.
And the two
you can also, I'm sorry.
No, go ahead. Continue, Mike. Sorry about that.
That's okay, no worries. So you can also save templates as well. So you can have templates available for your staff here. So, maybe it could just be an appointment reminder that I want to send out. Those could be all completely configurable, and we can load whatever templates you need in there, and you can also load them as well. I don't know if this is going to come into play, but you can have those specific templates that you want saved in another language. So in this example, it's Spanish appointment reminder translated. So you could just send that out in that patient's native language if you need to.
And you guys do that translating?
So we use our sister company, Stratus Video, that does the actual translation. They have some certified medical interpreters. It doesn't use like a Google Translate program at all. If you had a set of templates that, we need these in Haitian Creole or Spanish or Somali, whatever it might be, then we can work with those folks.
You take care of it. We don't have to. That was my question.
Either or, yeah.
No, that's great.
So those are really the on-demand communication options. We do have something that I was mentioning, those programs, which can be those medication reminders. They can be condition-specific programs, completely configurable, and then our assessment or our survey tool. So you want to send out yes, no questions, multiple choice. They could go out automated as well. You can have responses flagged. So if you see this diabetes assessment that went out to this patient, they responded, they had swelling. So your staff members, who's ever on that patient's care team, will get an alert for those as well.
Okay.
So I just want to show you the patient view real quick. And I know we're over time. I apologize.
Oh, no, that's okay. Dan did have to drop, but I'm still here.
Okay, so just to show you the patient view, this is where Steve was showing your logo would be up here. Okay. So this is me already logged in as the patient. If I had any reminders, they'll be on the home screen here. But you can assign a care team to the patient as well. if you want to give the patient access to either reach out to an individual or a group, completely on a patient by patient basis. So you don't need to give every single patient access to this, but think of it like a high risk type of situation where, a patient could just simply click on first available. It's going to route to the first available triage person in that group. And then there's secure messaging. And then here's the assessment. So they just have a general wellness assessment assigned to them. So if I just hit go back, you could do rating scale questions. These don't need to be within the app as well. You could send these assessments out by text or email. So they just click on the link, they go right into whatever browsers on their device, on their phone, on their tablet, or on their computer. And everything is reportable as well. So if you need to pull up reports on how people are responding to assessments across the board globally, or if you want to drill down into specific patients, you can see the responses.
Okay, do you foresee engaging with the patient directly, or is that just maybe something down the road?
We've had a few people that have come to us directly. So we have had the occasion. Now we do have a patient app with TA, but it's just not very user friendly.
Mhm.
So that's why I ask. But yeah, it is. I mean, it's probably not the easiest thing for us to go direct to consumer, but we do have those people that reach out to us. So within that though, too, within that chat feature, can they take a picture? I think we had looked at that before,
Yeah.
but
Yes.
Very
Okay.
easy.
Yes.
okay.
Yeah, they can send documents, they could snap a picture. I was just on my web browser, so I can only pull in.
Yeah, that's fine. I
library.
thought we had talked about it, but having done both demos, I didn't want to confuse.
Yeah,
No worries.
they
Yeah.
can. It's very easy. They could take a picture from their gallery, or they could take the picture live during the chat.
Awesome.
And you can toggle on and off whether the patient can be the one to engage in the secure message or the video call, or you could
Okay.
toggle it so they can only respond if you prompt them with a message first.
Okay.
Yeah, so they can't just go crazy messaging at 1 a.m. You don't want them to. But if it's high risk and you want to say, okay, you know what, for this next weekend, we want to make sure you don't run into any issues.
Yep.
You could basically give them the ability to reach out to you at any time that they want. But again, it's literally you click a button, and within like 5 seconds, it'll take that ability away from them.
Okay.
So Steve, Katie, I apologize. I'm about 5 minutes late to my
Yeah, no, that's
Sure.
okay, Mike. Well, we really appreciate it. Thank you.
Thank you guys. Thank you, Katie. Talk to you
Yeah,
soon.
thank you.
Bye-bye.
Katie, any final thoughts, questions, workflows?
No, I mean, I think Dan talked a little bit about what we would do with the prisons. We do have a pilot site that wants to work with us on this. So I was just trying to get a lay of the land. That's why I wanted Jessica to take a look, because they would be the end receiver, not me. But I'll make sure she gets the recording.
I will send this recording as soon as it processes, but
Okay.
we can configure those different groups for the different locations with the different permissions. We've done, we haven't done it in the exact same scenario, but we've done it with, home health agencies that are under a parent brand, and then they have different privately owned and named or franchise. So we have to build out the hierarchy in the system and who can communicate with who. But it's no problem. We do that all off the bat. And I don't think you're going to find anything that has to support the configure, being so configurable. It's easy to use to accomplish what you want to do.
Yeah, and that's our biggest thing, is the easy to use.
Yeah, I mean, as you saw, it's all simple clicks of a button. There's really nothing that you can break, even on the back end. Any adjustments you make, we could always, they can always be fixed. So,
Yep.
Okay. You can run it on your desktop, laptop, tablet, smartphone, whatever someone likes to use. They're pretty much in business using the Cincy app on there, and you can be logged in 2 things at once. So let's just say you are the clinician or the administrator at that correctional facility. They could be sitting in their office logged in on their desktop or laptop, and at the same time they can be logged in on their smart device. So they can get a call or a message, and they could choose which one to answer it on. Or maybe they have to go do something and they leave their computer and walk away, and they're down the hall. They're going to be logged in on their phone, so they're not going to miss anything. So you can be logged in on more than one device at the same time.
Okay.
So
Okay.
awesome. I'll send you this recording a little later. I'll send it to you and Dan, and I'll include Renee on that email as well. And then let me know what you want to do next, okay?
Okay, thanks so much. We appreciate it.
Thank you.